Well, good morning, everyone. My name is Maribel Ochoa, and I am the Communications Director at UnitedAg. And with us today, we have our partners at SAIN, Servicios Agrupados Integrales, also known as our cross-border network partners. And with us today, we have Gabby Garcia.
Hello, everyone.
What a great way to kick off the summer. I know tomorrow is the start of the FIFA World Cup, and I'm sure all of you will be tuning in to follow your favorite countries. So I just wanted to share that. Go Team USA. And with that, I'm sure Gabby will be rooting for the Mexico team. So the floor is all yours. Thank you, Gabby.
Hi, everyone. Yes, we're all getting very, very excited and ready for it. We never win, but we try. Anyway, so a little bit about us. I know we've probably most of you have heard of all the great benefits that UnitedAg has to offer. And I forgot to ask, actually, there is a booklet that UnitedAg presents, Maribel, where you list all the different types of services and providers you have for medical, for dental, mental health, and whatnot. So you might see a little logo that's ours right there, SAIN. And just we're going to explain a little bit of what we do, just so you get a better idea of what that little logo does and how we can benefit whatever needs you might have. So we are the Mexico Network, as Maribel explained. And I'm going to talk to you a little bit about who we are, how to access our SAIN network, and some of our benefits. As you can see, this is our little motto. We treat patients on a case by case basis. And we like to make a point of that because I know it might be a cultural thing, but rather than having just talking to, I don't know, let's say a chatbot, we do offer that in case, but we realize that not a lot of patients actually want that type of treatment or that type of service. So what we do here is we're just open to calls. And everybody calls. So right now it's gotten to a point where thankfully we've been doing this for over, wow, 30 years. And our team already knows some of our patients by name and their whole history. They call them, they catch up. It's a very personal service. So we do like to make a point that we treat everything on a case by case. We don't have a one size fits all model for everything. So we try to make sure that everyone gets the service that they need. Now, what defines us? I would say, aside from that, like I said, it's the years of experience. We focus on the quality of our care. That is a big thing for us. We like to make sure that everyone gets the best care possible. We like to make sure that communication is key. So everything has to be, God, this menu keeps popping up. We like to make sure, as I was saying, that communication is key. So we want to be very clear on the steps on how to access our program, what to expect when you're coming to Mexico. A lot of you might be familiar with receiving services in Mexico. A lot of you might be here for the first time. So it's always good to just make everything as clear as possible so that knowing what to expect, just who's going to receive you across the border, what's the name of the doctor you're going to see, who are you going to be talking to in our office, who's going to be your representative in charge of your case. Everything, we always try to make sure that everything's very cohesive. High affordability. Our plans are, I mean, as you all know, UnitedAg has amazing plans, and it's very important for us to always maintain good quality care with affordable prices. We eliminate travel hassles. Like we try to provide services that are very close to each other. As I mentioned, our video is a little long. It could be longer. We have over 160 providers in our network. So in order for us to actually be able to showcase all of them, it takes a while. So what we try to do is just to have most of our providers be closer to each other. So we have little segments here and there, just that it makes it easier that if it's a one-stop shop, you can have everything there. But if you have to see other specialists, that you can also have that service over there. So we try to have little, I was going to say, like little little one-stop shops everywhere throughout the border. No language barriers, which is very important when you're trying to explain what your diagnosis is, what your symptoms are to your provider. Some people don't feel comfortable explaining in English or in Spanish, vice versa. So we try to have representatives that can help you translate. In my case, as you can see, sometimes I can speak English, but I don't know how to get my symptoms across. So I would much rather receive my treatment here in Mexico. I love the States, but I don't know how to translate what I'm feeling. So this to us is actually very beneficial that we can choose. It's a great plan. It's international, so it's you get the best of both worlds. Like I was saying, our key markets, as you saw in the video, it's San Luis, Los Algodones, Mexicali, and Tijuana. Now, these are our key markets. And as you could see in the video, there were some renders for the Algodones section. That's because we just opened our new office, our new doctor's office, which we call SAIN Medical Plus, because it would be a new extension of our services. And that, as I was mentioning about our one-stop shops, we were trying to create that for Algodones as well, because previously Algodones has always been known for being a dental town. There's so many dentists, but the way we like to do it is we focus on one plaza, and that way you can just go to one place. You will get your dental, you will get your medical, and there's a pharmacy. Lab is right next door. So we're trying to make everything as easy as possible. So that render will turn into a video, which we will update in the coming months. Also, we do offer services throughout Mexico. More than anything, if there is an emergency when you're traveling to Mexico, I always like to emphasize if you know you're going to be in the country, send us an email. I mean, just let us know, like, hey, this is so and so, this is my ID number. I will be traveling for the next week or two. And that helps a lot because if there's any emergencies, God forbid, we will already know and if we can help you with that. So we will definitely try to negotiate and try to take care of what services you might need in case of an emergency. Um, let's hope not, but any accidents or I don't know, let's say an appendicitis, like those things actually qualify. We're also trying to expand our services to Jalisco, to Guadalajara. So that will be something that we're opening up. If there is a demand for a different city, definitely let us know. That will definitely allow us to grow our network more. But yes, everything that you might need, any emergencies at the moment, just let us know and we will definitely try to um, help you with that. Like I said, our medical and dental network, we have providers from multiple specialties. Now, here we have our overall list of specialties that we work with. If there's something that you don't see here, it's because it's not as common. For example, we do work with regenerative medicine. It's not something that is covered at the moment, but it's something that we already work with. Cardiology, internal medicine, orthopedics, neurology, physical therapy, very important because as we all know, sometimes you could have a procedure, but PT, as I was talking to Maribel the other day, if there's no PT, then the surgery might not be a success, right? So it's always good to complement, and everything has to be working together. And we try to coordinate everything from one office. So these are all the specialties that we work with. Now, how to access the SAIN network. This is a quick 1 through 4 step and very simple. Once you have coverage with UnitedAg, you have access to the SAIN network. Now, a lot of people visit our offices to get just a pass. We call it a pass so that if you already know what diagnosis you have, like if it's a chronic illness in this case, if you already know you need to see a cardiologist, you need to see internal medicine, endocrinologist, diabetes, whatnot, you can just let us know and we will help you coordinate that consult or that appointment with a specific provider, right? Normally, we request everyone to actually go see, as same as in the States, go see a primary physician. And from there on, they will guide you to see which specialist you actually need to see. Sometimes we might think we know if it's not something that's already been previously diagnosed, like a chronic illness. Sometimes we might think we know what specialist we need to see, but just to be on the safe side, we always request to see a primary physician. They will guide you to the proper treatment. Okay. But like I said, if you're not sure, primary physician. If it's a diagnosed chronic illness, we will work to get you an appointment right away. The copays, they're based on your medical plan. I believe most copays right now are ranging from $5 to $10. And that will be for office visits and for RX, so for pharmacy medications. And hospital copays, that will differ. Now, the biggest difference here from the States is that what you pay from your copay, that will be it. That's it. $5, $10. Even if it's a surgery that takes, I don't know, you're hospitalized for over 3 days, 5 days. I mean, God forbid more than that. That is your copay, whatever your hospital copay would be. I don't think there's anything higher than $100, but it varies. Some people have very low copays. There will never be a deductible. So deductibles don't apply in Mexico for most of the plans. I believe we have a few HSA plans that do apply a copay, but other than that, it's $5 and that's it. You will never get a follow-up bill afterwards. But yeah, if you have any questions regarding your specific plan, please feel free to reach out. I do provide little flyers like this. So in real life, you might see it. I try to make them very small so that you can always have it in your wallet. And it's a little accordion, English and Spanish, and it will have the steps 1 through 4. Just make it very simple. These are all the places where you can have your first point of contact for primary physician, second, where to see your doctor or specialist, your pharmacies, and I'm sorry if you have any questions on that. We will also add contact at the very end. This is not an image, but it just has our phone numbers. It has our contact form from our website. I receive those messages personally, so please feel free to send us any messages because I know sometimes it could be very late at night. All the businesses are closed. So even if you think of something at midnight, send me a message first thing in the morning. I will know who to direct, that message to, and one of our team members will actually reach out and help you with whatever inquiry you might have. Um, yes, but also for your plans, if you have any questions on that, seriously, it's very easy to check your coverage. So you will definitely get an answer within the same day, within a matter of hours, if anything.
Gabby, quick question. For the pamphlets that you just shared,
Yeah.
who can the HR directors or members, who should they reach out to request some of these pamphlets? Should they email you directly or contact client services?
Yeah, they can contact client services. I mean, the contact form is our big uh, option for anything. So, like I said, that contact form, it's linked to my email. So, whatever you need, even for this, I will definitely we can redirect that so my team can start packing up everything. Just tell us how many you need, and your address, and we can ship that right away.
Thank you.
Welcome. Here for our member ID cards. We like to create SAIN ID cards. It's not a must, but we highly recommend them because some of our providers, like all the providers in the stateside as well, they see multiple insurances. So it's best to always identify yourself with SAIN because they will treat you sooner and they can also find you faster in their systems. Like there's more than one system and people actually find it a lot easier for them to just know, okay, that's SAIN. I will go to this part of um, my computer and they find you right away. Now, to get a SAIN ID card, there are two options. Again, going back to that contact form, you will love or hate that contact form. It's very easy. You can just take a picture of yourself, upload it, sign digitally, give us your address, and we can email you or mail you, sorry, that ID. Or if you want to visit our offices, our teams here, they can take your picture and it will be done in like 15 minutes, nothing more. There have been actually some groups that during open enrollment, they've taken pictures. We've processed their ID cards, and once we get their ID number from UnitedAg, we finish them up, but we already have everything done, and we just ship all the ID cards to those groups. So that also helps, and that makes it very easier, so that you can just pick up your ID right then and there with your HR. Now, for telehealth, this is something that we've started offering since COVID. Now, we saw that there was a need, especially like I've mentioned, for chronic patients, like they still needed their medication. And it was easier because it wasn't an emergency, right? Obviously, if it's an emergency, please call 911, reach out, or go directly to one of our clinics or hospitals. But yes, we launched this just to make it easier just to talk to our doctors, pick up prescriptions. I have to say it hasn't been that popular in Mexico because everyone likes to actually have in-person appointments. But if this is something that you prefer, we have doctors 24/7 that they're ready to actually to help you with that. Okay. Now we work with UnitedAg to offer the travel reimbursement program. And this is mostly for members living 150 plus miles from the border. And you can opt to receive medical procedures in Mexico. A lot of people actually choose that route because some of you might have relatives that live in the Mexico side. It's easier to recuperate with extra help, obviously. As we mentioned, language barriers, it's a lot better. It's easier to explain. Now, what does it reimburse? It reimburses any of your travel, for example, your hotel accommodations, your meals, companion travel, patient travel. Now, it would be just one companion though. So if you ever feel that you're getting, I don't know, you might have started a treatment in the States, but you want to finish it here in Mexico, you can definitely reach out to us, or you can also contact UnitedAg and ask if you qualify for the travel reimbursement program because it's mainly for these kinds of procedures. It's for major procedures like bariatric surgery, hip or knee replacement, hysterectomy, like anything that's longer stay, not outpatient or ambulatory. It will definitely help a lot if you travel to Mexico and are close to your relatives, or if you just like the treatment. I mean, whatever your preference, but it does qualify, I mean, to one companion, and you would have to coordinate with our office just so that we make sure you have your hotel stay ready. Any questions, like I've always said, like communication, any questions that you might have about what to expect with your procedure, how many visits you would need to get. It's very important to mention that even if you've already started your treatment stateside, like I said, but they said you need X, Y, and Z procedure. It's very important that our Mexico doctors see you and they do their own evaluation. Sometimes they might not agree with the type of procedure you were recommended. So it's very important that they feel comfortable with what you were told that you needed, right? So until you see the doctor, then they will request to do a pre-op labs. It would be labs, x-rays, and then you get your procedure. So just keep in mind, it will be more than one visit because they do have to see you first and then schedule that appointment. Once the doctor knows exactly what procedure you will need, we will request a pre-authorization to UnitedAg. It's very fast. It normally takes like 3 to 7 days tops. Like, yeah, like over a little bit over a week. Rarely does that happen. It's normally like 3 to 7 days, and it's very quick. You can have everything done with one visit. Get your pre-ops, get your office visit with your specialist, and then just come back for the procedure. Like it's very easy, actually. We've been told that stateside you can get results. I think it takes a little bit longer. Here in Mexico, the results can be ready the same day, or depending on the time that you did your test, it will be ready by next morning. So that speeds things up a bit. Now, how to qualify, like I said, you can call us or call UnitedAg. We will, once eligibility is confirmed, we will schedule an appointment. We will coordinate travel and accommodations, and then you can just attend your appointments. Also, please keep in mind you have to save all your receipts and send them to us so that we can help with that reimbursement. Now, here are some of our key benefits. Again, it's just contacting our office. The more that you feel comfortable talking with our team and just reaching out via email, website, phone, our WhatsApp is on our website as well, the easier it becomes for them because they already have like everything identified regarding your case, and they can just follow up. There are some times where we know we have a chronic patient, for example, and if we know that, you know what, it's getting close to like his refill, and if he hasn't reached out, we come like, hey, are you going to need help like scheduling an appointment? Like we try to reach out to make sure that everyone receives, because their service, right? Because sometimes life takes over, gets the best of us. So we try to help out with as much as we can so that you're not left without an appointment or without filling your prescription when you need it. And this is another plus that we add. It's our wellness approach. We've been having this campaign for years and years. It's our Be Healthy campaign. And what we do, we just create content. We're always going to create content on our blog, and it's just going to be health tips. We try to do it more targeted towards cases that we see most common. For example, obviously during COVID, it was just all about immunity, right? Just being healthier. Last 2 years, I believe hydration has been a very big thing. We saw a lot of dehydration, and we try to create content that's just like how to recommend people to stay hydrated, because sometimes water is boring. So we try to like come up with different recos, or just to remind people to actually do X, Y, and Z, eat your water. No, it's a big popular one because sometimes we just take it for granted and we don't think about it. And sometimes because it's winter, well, during winter, we see a lot of those cases as well. So we're always trying to create little information here and there. Now, some groups, if they feel they want us to talk about something in particular, please reach out. I mean, we can definitely work with UnitedAg so that we can create that content together and just provide you with as much helpful information as we can. And again, this is our website, signmedical.com. These are our offices from the outside. This is my office right here. And that is our team or client service email. It's info@signmedical.com. You can reach out in case you have any questions. That QR code right there, it sends us to our contact form, and that I would say save that contact form. It's very handy. Or our WhatsApp number. But yeah, if you have any questions, anybody.
Thank you, Gabby. I know you covered a lot of content, and there'll be a pop quiz for those of you that attended. Joking. No, it's all fantastic information, and we don't expect for you to know the ins and outs of the sign benefit. but we will be sharing the deck, the recording, and also some of the key materials that Gabby has put together in English and Spanish that are fantastic. I'll also share the live link of the video. Gabby, unfortunately, the audio was not sharing. So,
Oh,
but we have the link, so we'll go ahead and share it. And yeah, any questions from the audience? We know we covered a lot of information. I will say I was at an expo, was it 2 weeks ago? Um, and there was a lot of interest in our partnership with SAIN. A lot of companies that do import export didn't realize that there was such a benefit available. And many of you have organizations that, focus even on logistics or other things like that. So keep in mind the SAIN program because it's a great perk. And more than anything, the cost of healthcare is rising, and our partnership with SAIN really brings to light the importance of, cost shouldn't be an issue for you to seek care. I know there's been some requests, Gabby, from members if you could provide a comparison of what the cost of these surgeries. I know in the past you provided maybe a summary like 3 years ago. But
yeah.
with the rising cost of both in the States and in Mexico, um, for services being rendered, would you be able to provide at least some of the key or most frequent procedures and surgeries that are being conducted in Mexico, just for people to gauge what the cost savings are?
Yeah, for members.
Yes, just so they
Yeah.
can see the price, the savings
Oh,
and the comparison of
yeah. For example, even just very simple example, to get a CT scan or an MRI, just very basic, you would have to have your office visit, which would be $5, and your CT scan. And that's it. There's no other additional copay for your CT scan or MRI. Stateside, you would at least end up paying like $1,000 because you haven't met, maybe you haven't met your deductible, right? So that would definitely be part of your out of pocket. So $5 compared to 1,000, like that's not even a surgery, and that's just a test. So that's one of a very simple example. If we want to go into surgeries, like I was telling you the other day, as well, that wasn't even a surgery, and it was just an emergency visit, and it ended up being like $10,000 for less than a day. It was like 8 hours, I believe, just for observation and some tests. And here in Mexico, I mean, it was one day. So it would have been what your $5 office visit. And if the doctor has to keep you in for observation, that would have been your hospital copay. It could be your plan could be five, it could be 10, it could be 50, depending on your hospital copay, but it's not going to exceed $100, let's say. So that's the biggest difference. For surgeries as well, it's just your hospital copay, and surgeries can range, obviously meeting your deductible, which could be anywhere from 3,000 to 6,000, depends on the type of plan that you have. It could be individual or family. And then on top of that, aside from your deductible, I believe there's an out of pocket max, right? So that could,
correct.
yeah, so that could also increase the cost by like you can easily spend like $6,000 compared to $5.
Thank you. Another great question from the audience is, does Sign provide medical fast pass for border crossings?
Right now, the medical passes are being given out to when people get procedures. So, for example, if you have just a checkup or just a visit to your specialist, you might not get a medical pass. But in Mexicali, Tijuana, I think they're opening them up to procedures and MRIs, but I would have to confirm. I know at the time being, it's only for procedures and if hospitals give out those passes. In TJ, there's a benefit that the dentists actually are inside of the hospital. So they automatically can take advantage of the medical pass. In Mexicali, it's just procedures at the moment. And in San Luis, they haven't opened up a lane for medical pass. But if anyone has a Sentry Pass, that helps.
Perfect. And all this would be notified to the member when they call to
Correct.
begin coordination, correct? Okay.
Yes.
There's another question. I'm not sure. Obviously, it would be depending on the medical advice. But there's a question that reads, do you know if a hysterectomy requires an overnight stay?
Oh, yes. Yes, it
Okay.
does. Mhm.
All right. So in Mexico, a hysterectomy would require overnight stay. So that's where coordination of care
Mhm.
would fall. Or this
Yes.
would be a good example for coordination of care.
Mhm. Yeah, exactly.
Another question from the audience, which I think you just covered, is the deductible the same in Mexico as it is in the US?
It would only be the same for the HSA plans, I believe. Now, those are very specific plans that you have to meet your deductible before you can actually get full coverage, right? But that deductible, we've opened it up to actually be able to utilize it in Mexico and in the States. The other way around, Mexico and the States. Yes, so that would be the only plan that we would have to meet that deductible, and
Or
you would have
criteria.
to make payments directly to SAIN until we meet a deductible.
Excellent. Any other questions from the audience? Hold on. I think someone raised their hand. Let me see here. Mariana, would you like to ask your question live? Mariana Velasquez? If you could unmute yourself, you should be able to ask your question live. Okay. Maybe she was just high-fiving us. Okay. All right. With that, for companies that are beginning to coordinate open enrollment meetings or health fairs, how would SAIN be able to, or would SAIN be open to participating in some of these engagement opportunities?
Yes, of course. We currently help with open enrollment. As long as we can get notice, I would say like a few weeks ahead of time, just so that we can have enough material ready. Sometimes when we have open enrollment back to back, we just have to make sure that we have everything printed out in time. But other than that, yes, we can definitely help. Normally it
Excellent.
would be my brother or I assisting. So
Excellent. And I know we have a lot of companies that are looking to coordinate events in the next couple of months. So she indicated, be sure to pre-book early on. Um, Please contact your client services manager to begin coordination in collaboration with SAIN as they would love to participate and once again communicate these benefits to your employees and answer any questions they may have regarding this unique benefit that I myself have even utilized. I visited my new ortho is actually from the SAIN network,
Bonnie.
and I can vouch for the fantastic work and the coordination of care and just how quickly services are rendered. So with that, I'll give it one last minute for any additional questions before we conclude today's programming.
Yes.
Okay. All right. Well, thank you so much, Gabby, for taking time to present SAIN to our broader membership and service rep community. We look forward to collaborating with you this fall. Apologies. One of the hardest things with braces is learning how to talk with braces. So please be.
Listen, I have braces and I can't talk. You're good. You're better. I'm better than Steve.
So with that, as Gabby indicated, it's going to be a very hot summer. Be sure to stay hydrated and Good luck enjoying the FIFA World Cup, and we'll be here supporting any services or questions you may have. Thank you, everyone.
Yes. Celebrate safely.
Yes. Bye.
Bye.